Georgia's vaccine rollout definitely experiencing some problems. Website crashing, phone systems overwhelmed, and tonight we're working to find solutions. Our Hope Ford joining us now live with what experts have identified as 3 big problems and 3 possible solutions.
Yeah, that's right. The American Hospital Association estimates 1.8 million people. 1.8 million people would need to be vaccinated every day in order to reach widespread immunity by the summer. At the current pace, that doesn't seem likely unless 3 major areas are addressed to help states like Georgia ramp up efforts.
25 million vaccine doses have already been distributed, but right now barely 9 million people have received their first dose. That leads to problem 1, a lack of a federal plan. How the vaccine would be distributed was left up to each state. Senate Democrats sent a letter to the Trump administration demanding it make changes to the rollout strategy. A vaccine allocated on a spreadsheet is not enough to protect anyone, lawmakers wrote. So the solution? Well, a federal plan. Senate Democrats hope for a plan that supports local and state health officials.
I think local public health is doing the best they can. Candidly, it's not enough.
Dr. Harry Hyman with Georgia State University brings us to problem 2, a lack of money.
We have historically underinvested in public health.
To properly distribute a vaccine, doses need to be stored, tracked, and appointments scheduled. To do that, proper staff and funds are needed. So the possible solution?
The state of Georgia sits on a over $2 billion rainy day fund.
Lawmakers already dipped into the fund last year to make ends meet, but Governor Brian Kemp is set to release his budget proposal this week. The final problem, small doses in small doses. Currently, states continue to struggle to get people their first dose. The Trump administration is withholding about half of available doses to ensure there's enough available for the required second shot. Pfizer board members say that may be hindering efforts.
I think we could be pushing out more vaccine right now, given the fact that this is the most critical part of the epidemic, and take a little bit of risk that there could be a delay in a second dose.
The solution could lie in what states like Oregon, New Jersey, and San Diego are doing, opening mass vaccination sites.
They will roll down their windows, a nurse will come and give them the vaccination, an observer will watch them for 15 minutes to make sure that there's no reaction.
The Georgia Department of Public Health says they're currently discussing mass vaccinations as vaccine supplies allow.
And that's kind of another bonus problem is vaccine supply is limited. Piedmont Healthcare told us yesterday that because of this, they're asking patients not to contact them. Instead, they will contact patients to schedule appointments as the vaccine becomes available.
All right, Hope, a lot of folks hoping to see some positive movement in this vaccine rollout. Thank you so much.